Hello everyone, and welcome to our Unit 4 Inpatient Medical Coding scenario. So if you're at this point, you've made it all the way through our content, and I hope you're excited to explore medical coding in the inpatient setting further. So in this practice case, just like the other weeks, we're going to go through it together. I'm going to give you the codes at the end, but my hope is that you have coded it before you've listened to this lecture. So if you haven't coded it, please stop right now, read through the case that's in the course, try to find the codes, and then write them down and compare to what I go over at the end of my short lesson here. So again, like I said in my content, I would recommend that you read the discharge summary first. The discharge summary is an overview of everything that happened to the patient while they were in the hospital. Then I personally like to read the H&P second. That gives me an idea of what brought them in, because remember, in inpatient coding, our principal diagnosis according to our UHDDS guidelines is what brought the patient to us after study. So reading the H&P gives us that idea of what brought the patient in, and then reading the discharge summary gives us an idea of what brought the patient in after study. Then we also, according to the UHDDS guidelines, code any coexisting or complicating diagnoses. So I like to think of this, anything that they treated, anything that complicated the care, anything that required a procedure or some kind of service. All the chronic conditions that the patient brings with them, diabetes, congestive heart failure, atrial fibrillation, COPD, all those things that the patient brings in with them that they're already medicated for, those are all secondary diagnoses, unless one of those is in exacerbation and is the cause of the acute visit or the principal diagnosis. But if they're in addition, then we want to code those, because those can bring our DRG to a higher level, the MSDRG, by being a complicating or coexisting comorbidity or complication. So that's why it's always important to make sure that you're picking up all the documented diagnoses, okay? So with this case, I won't read it all to you, because again, you should have read this prior to me going over this. But our patient is in, she had nausea and vomiting for 3 days, had some constipation, which actually resolved, but the final diagnosis is gastroenteritis. So with that, we are not coding the signs and symptoms. So nausea and vomiting are a sign or symptom of gastroenteritis. So we're not coding the nausea or vomiting. We're just coding the gastroenteritis, because that's the cause of why she was throwing up. We also want to code, like I said, any secondary diagnoses, so anything that coexisted or complicated her care. So our patient was autistic, and she also had attention deficit hyperactivity disorder. So we have 2 additional codes there as well. There weren't any procedures. She did get IV fluids and clear liquids, but those aren't procedures that we code. Those are not invasive, and according to our UHDDS guidelines, they don't meet the criteria for coding in an inpatient stay. They're kind of routine, right? Everyone or most everyone in an inpatient setting is getting some kind of IV and some kind of medication, some kind of diet and liquids. So all of those things are routine. They're not coded. So then you want to pop down to the H&P and just look over everything and make sure there's nothing that we missed. Social history, we would want to pick up if there was secondhand smoke, but there's not. There's not any smoking. There's no allergies, no family history that's pertinent. So again, just the past medical history that she's the autistic spectrum disorder. So again, we're going to code that as a secondary diagnosis, and her autism as well. So now let's go over to 3M. So our patient is 10, and when you're coding inpatients, you want to make sure that you hit the DRG finder. DRG, MSDRG, they're used interchangeably. So pick the DRG finder, hit continue. And this patient disposition, that's asking us where our patient went when they left us. So our patient went home. We're going to pick number 1. So again, if you have your codes, if you look these up before, you can enter them. If you need to look them up, then you can type the word. So we're going to code the gastroenteritis. So I'm going to hit 1. And then it's asking us the type of gastroenteritis. Well, our documentation didn't say. So I'm going to hit E. And we don't know, again, the type. So we're going to pick unspecified, number 4. And you'll see that's our admit diagnosis. Okay, so admit diagnosis is what the patient comes in with. It's really just a placeholder. But what we use for our MSDRG and what we use for reimbursement is the principal diagnosis. Sometimes the admit diagnosis is the exact same as the principal. Sometimes the admit diagnosis might be a sign or symptom if the doctor hadn't have said gastroenteritis. Here, for the admit diagnosis, I could have coded the nausea and vomiting. But the doctor did say that, so I'm going to put that as my admit. And then now I'm going to hit add diagnosis, and now you'll see my screen toggled and says ICD-10 principal diagnosis. So the principal is the same, the gastroenteritis. We're going to do the same steps. 1 and then E and then 4. There's our code again. Now we still have 2 other codes that we need. So we're going to hit add diagnosis. And our patient had autism. So we're going to hit 1. And it said that it was a spectrum disorder. So we're going to hit 4. And then here it says, were there any developmental disorders associated with that? So we're going to hit 3. We're going to spell and see if the hyperactivity and attention deficit disorder comes up. So I just typed the abbreviations. If you know the abbreviations for most diagnoses, you can just type those in 3M to get the code. So I typed ADHD for our attention deficit hyperactivity disorder. And there it is. I'm going to hit number 1. And it didn't specify if it was combined, hyperactive and attentive. So we're going to pick unspecified because we don't know. And now it's asking us if she has any of these other conditions. Well, nothing else was documented, so we're going to hit no. And there's our 2 secondary diagnoses. So once you're all done coding your inpatient, you hit continue. And there's our DRG. You'll see it's 392, and it always runs at the top here as well. So our admit and principal diagnosis are the same, the K52.9. And then our secondary autistic is the F84.0 and attention deficit is F90.09. Now the other thing we need to do is put our present on admission indicators. So I'm going to right click and I'm going to do present on admission. And all of these she had when she was brought into our facility. So we're hitting yes on every single one. And the nice thing I love about this screen is if you're not sure about the present on admission guidelines, which we just went over not very long ago in our class, but if you're not sure, you need a refresher, you can click right here on this blue hyperlink and they come up. But all of ours she brought with her to the hospital. So they were present when she was admitted, so we're hitting yes, we're hitting OK. And now you'll see that our yeses are right beside the code. It didn't change the DRG, it didn't change anything here, but you still want to make sure you have those. So when you're all done and you're ready to code again, you hit next patient. I hope this video was helpful.